In the world of emergency medicine, there's some tools that are so incredibly powerful, so fast, that they really walk a fine line between life-saving and, well, life-threatening. Today, we're going to talk about one of the most potent of them all, succinylcholine.
So I want you to imagine this. A patient can't breathe. You've got just moments, literally seconds, to get an airway. You have to act, and you have to act right now. This is the exact kind of scenario where a drug like succinylcholine doesn't just help, it might be the only thing that works. Let's really break down why that is.
Okay, so the single most important thing, the defining feature of this drug, is its incredible, almost unbelievable speed. Seriously, nothing else in a doctor's toolkit even comes close.
We're talking less than 1 minute. Think about that. From the moment it hits the bloodstream, it takes under 60 seconds to cause complete muscle paralysis. This wild speed is exactly why it's the go-to drug for something called rapid sequence intubation, a high-stakes procedure where every single second is absolutely critical.
But here's the flip side, which is just as important. Just as fast as it kicks in, it's gone. The paralysis usually only lasts about 5 to 10 minutes. And that short duration, that's what gives clinicians an incredible amount of control. It's like flipping a switch on and then a few minutes later, flipping it right back off.
And yeah, this little chart just says it all, doesn't it? It really puts it in perspective. When you stack it up against other neuromuscular blockers, succinylcholine is the undisputed champion of speed, both for how fast it starts and for how quickly it wears off. It's the sprinter in a field of marathon runners.
So how in the world does it work that fast? Well, the mechanism is really unique. The best way to think about it is like a master key, one that fits the body's locks a little too well.
Okay, so its official name is a depolarizing blocker. Now that sounds super technical, but what it really means is that unlike other drugs that just block a signal, this one actually pretends to be the body's own natural chemical, acetylcholine, to kick off a crazy chain reaction.
So here's how that whole master key idea actually works. Step 1. Succinylcholine goes right to the muscle receptors and fits perfectly in the lock. Step 2. It actually turns the key, which makes the muscle fire one time. You can actually see it as this little twitch, which doctors call fasciculations. But here's the real twist. In step 3, the key basically snaps off in the lock. It gets stuck there, and because it's stuck, no other signals can get through. And that's what causes the total paralysis.
Okay, so with a mechanism that powerful, you have to wonder, when is this actually the right tool for the job? In what kind of situation does this drug become an absolute, no questions asked lifesaver?
Well, it's really saved for the highest stakes moments. First and foremost, for those critical emergency intubations we talked about. Second, it can be used to stop a severe laryngospasm, which is a terrifying thing where the vocal cords just slam shut. And finally, for some very quick procedures where you need total muscle relaxation and you need it instantly.
All right, but this drug demands a huge amount of respect, because for all its life-saving power, it is truly a double-edged sword. And that other edge, well, it's incredibly dangerous.
The risks kind of fall into two big categories. First, you have the contraindications. These are the situations where you absolutely must never use the drug. We're talking about patients with major burns, bad crush injuries, or certain muscle diseases. And then you have the adverse reactions. These are the serious harms that can happen, like a sudden drop in blood pressure or a potentially deadly spike in blood potassium, which is called hyperkalemia.
But there is one risk that really needs its own spotlight: malignant hyperthermia. It's rare, thank goodness, but when it happens, it is a true medical catastrophe. For some people, the drug triggers this runaway chain reaction in the body, causing a massive spike in temperature and intense muscle rigidity. It requires immediate, aggressive treatment to even have a chance of preventing death.
So, given these incredibly high stakes, using succinylcholine is never a simple decision. It means you have to follow a very strict set of rules. You can think of them as the rules of engagement for one of medicine's most powerful drugs.
Yeah, the list of things to keep in mind is pretty long. Trauma patients might already have high potassium, making the drug extra risky. Pregnancy can make a person more sensitive to it. But this last point on the list is truly chilling. It paralyzes the body, right? But it does nothing to stop seizure activity happening inside the brain. So the patient could look completely still while internally a massive seizure is going on.
And that brings us to the single most important and, frankly, the most terrifying fact about this drug. This is a direct quote from medical literature.
Succinylcholine has no sedative or analgesic properties, despite the patient appearing flaccid and unresponsive.
Let's be crystal clear about what that means. The patient is awake, they are aware, they can feel everything, they can hear you talking, but they are completely trapped inside a body that cannot move, cannot speak, can't even blink. This is why giving a sedative isn't just a good idea, it is an absolute ethical and medical requirement. You have to remember, paralysis is not sleep.
So, all of this leaves us with one final thought. Succinylcholine is the fastest tool in the box, no doubt. It's an undeniable lifesaver in the right hands at exactly the right moment. But with such a razor-thin line between rescue and risk, the question every single clinician has to ask is it always the right tool to use?